Hey, if you're diligently following a low FODMAP diet and you're still having these unpredictable symptoms and toilet habits, then this is what you need to do to resolve it. Just quickly, my name is Joe. I'm a dietitian. Our company helps people reverse digestive symptoms in a sustainable way. So we know that a low FODMAP diet can help reduce and manage symptoms by like 75 to just over 80%. But there are some other aspects that are arguably, well, sometimes even more important than the actual diet issues themselves. Of the factors outside of FODMAPs, number one has to be stress and anxiety. So think about it's your gut-brain axis. You've probably heard of that term. And what that refers to is it's your vagus nerve, essentially, the nerve that actually connects our thoughts to our gut and sensations in our gut and vice versa. So think about like when you're nervous, right? When you were young, it was like before a race and you got butterflies in your tummy. That's where that term comes from. So that's like the feeling here presenting as a feeling in your gut, right? And unfortunately, when you're an adult, the nerves are typically before something or anxiety before having to do something, and the symptoms are not just butterflies in the tummy anymore. They're oftentimes get out of my way. I need that toilet right now. So there's no doubt that stress and anxiety are playing a huge role for a lot of people. The way you actually would treat that if it was just your anxiety causing symptoms is what's called gut-directed therapy. It's evidence-based. It's shown to be equally as effective as a low FODMAP diet in those who are having IBS symptoms. For a lot of people, it's a combination of both. It's FODMAP sensitivity and the anxiety or stress contributing. And with our clients, we actually address both of these things because the reality is it's very rarely one or the other. So yeah, if you work with us, we're really going at it from a holistic point of view, evidence-based holistic point of view, trying to touch on all the different points. Now, the second one is fiber. Okay, so not only like total fiber, the reality is it depends on your situation. We've got some clients like diverticular disease where your like lower fiber intake often has better outcomes and essentially at certain times of your treatment, right? And it might not be the way you go forever, but we have to play around with total fiber and type of fiber. And so to do that, you need to be a little bit methodical, right? Because who knows, oh, I ate 30 grams of fiber today. Like you can't just pull that stuff out. You actually need to be a bit intentional about these things. And so it's a big factor. Amount of fiber, how consistent you are through the week, and the type of fiber. So that's the second thing to consider. Number three, FODMAP stacking. I've talked about this a lot. If you scroll through my videos and stuff, you can find that. But essentially, remember that foods they're not no FODMAP, right? This is low FODMAP because almost any food with carbohydrate has FODMAPs in it to some extent. So you're reducing the load of FODMAPs. You're not getting rid of them. And the reality is, if you eat a lot of a low concentration of something, if you eat that many times, it still stacks up and becomes a high amount that you consumed. You just had it multiple times in low doses. So you need to be that's what stacking is. So it's the stacking of your exposure or dose to that compound. And if there's not enough time for your body to digest and process and get rid of that compound, then it stacks over time and can still cause symptoms. Number four, other compounds that aren't FODMAPs. So think about caffeine, if that's a trigger for you. We have capsaicin, which is a food chemical in spicy foods that triggers people. Alcohol as well, and total fat content. Total fat is a big one. Number five, so if you're following a low FODMAP diet diligently and you're not getting results, what we'd look for with our clients is there's a couple of things. So there's SIBO, small intestinal bacterial overgrowth. This needs to be treated first and typically not just with diet changes. So there's SIBO and there's food chemical intolerance, which is a specialty area of ours as well. So things like salicylates, amines, some other food additives. These are not FODMAP compounds, but are food chemical compounds that definitely can cause digestive issues, among other symptoms. Number six, we'll give a mention to hormones. This is the final one. So, if you're If you're a woman and it's like your time of month, your symptoms can get worse. And this is because of the hormone changes in your body. So estrogen and progesterone changes. And then of course, if you're pregnant as well, we notice a big shift in symptoms. They can improve greatly during pregnancy, or they can get much worse. And then things flip the other way after pregnancy. So it's very clear that hormones matter as well and have an influence. So you need to make sure that you're doing everything you can there to keep things in balance. As you can see, IBS and having digestive issues where IBS is a component, it can be very complex to manage on your own. Like, no wonder if you've been trying for a long time and you still feel stuck or frustrated. There's so many factors to consider, and I didn't even cover all of them. And obviously there's no time to go into depth with any of those things. But hopefully that broad overview helps you get some clarity, at least where you might want to shift your focus. If you found this useful, please give us a like or a heart. Tag someone if you know someone who might find it useful. And of course, if you want some personalized help to get through this process as fast as possible, just comment me in the comments, or you can send me a direct private message and we can just have a chat, see if we can help you and go from there.